Hello, Get Better Faster Nation. I am Dr. Jason Bradley, and along with my co host, the one, the only James Chester, and our incredible executive producer, Rachel Bradley, we want to welcome you to another exciting episode of the Apple top rated Get Better Faster podcast. Today, we are joined by a true disruptor in the world of healthcare. Dr. Mike Rubenstein is a business strategist, chiropractic doctor, and co-founder of Relief Now Laser Centers, a national platform that is guiding doctors to help thousands of their patients escape the pain game using his regenerative laser therapy method, all without the scalpel and without drugs. Through his mission, Ditch the Drugs and Skip the Scalpel, he is fighting to expand access to opioid-free, drug-free, non-invasive pain relief for people all across this country who are sick and tired of being handed yet another prescription and sent home. Dr. Mike is passionate about health freedom, and today he's bringing that energy directly to you, our Get Better Faster Nation. Dr. Mike, my friend, welcome to the show.
Guys, thank you for having me. I'm happy to be here. Pleasure to see both of you. I saw James a little while ago in 3D. Now I get to see him on the screen, but so everything's great.
Yeah, Mike, I've been following your work with your partner, Dr. Rob Hannapol, for a couple years now, and got to know your group and organization that you've been running to help more people. Actually, really, I noticed what you guys did is you took a model and that was fundamentally, I would say, needing assistance. So maybe not broken, but it needed assistance. And you guys brought something new to the table for practitioners. And I know that there's a huge project that you guys have been working on, branding it, rolling it out, helping the different communities across the United States. So origin story, let's just break right into it. And I know I've given some preemptives on what you guys are up to, but maybe from your words, why did you decide to run this type of model? And when did you realize it was something that could get people better faster?
So great question, James. So originally, and as Dr. Rob likes to say, it was a wet dream, meaning that he had a shower thought, and he took this shower thought and he, talked to me about it, and we were like, wow, there's definitely something here. And when we were in practice together, we were seeing a difference of how people were getting better and how they were treated with laser therapy. And Dr. Rob's been practicing a little bit longer than I have. So he's seen different lasers, how they've changed through the years. And that was kind of the foundation. And we saw what was happening. And, we both had this conversation, like there's definitely a better way to how to take this and apply this to a business model and to other doctors. And that started back actually pandemic time was when this was all kind of going. And the model and the company and things have changed so much since then. I mean, it's amazing. Like when you see like those old files on your computer of where your business was, and you look to see where it is, it's kind of remarkable to kind of see these things build up. So that's kind of like the long and the short of it. And that's kind of how it started. And it's just we've been chipping away at it ever since. And doctors love the mission. Doctors love the two practices, one roof, right? They have their chiropractic office and they have a Relief Now Laser Center. So for example, it would be James Chester, right? Chiropractic, and it would be Relief Now Laser Orlando. So they have that now ability to treat more patients at a different capacity and get that 87% of people that would never come see a chiropractor into their office.
Yeah, as I've gotten to understand the model, you're talking about the laser systems. How have you seen, because I think that's a really important thing for people to have an identity for. How have you seen the laser industry shift over the past 6 years?
Mm-hmm.
I mean, it's blown up. I mean, you have people that are now offering, so it's not just laser, it's even like the red light, right? Therapy, but it's all the same type of process in terms of what it does scientifically to photobiomodulation. So we've seen lasers go from these little rinky-dink class 3 A's and B's to now you have class 4s that are, and a lot of this has been around for a while, but the implementation and the use is getting so much different. And it's definitely blown up. I mean, to people using like I said, the red light therapy beds, the laser systems, it's definitely on the cusp of exploding even more. And as doctors learn how powerful they are and can get out of their own way and just say, hey, chiropractic is great, but there's benefits to these other tools. And I feel like a lot of that mindset holds people back of kind of getting in their way, right? Like chiropractic is great, but wouldn't you rather be able to get the other 87% in to get, the red light therapy or the laser therapy and stuff? I think that's super important.
I think it's super important as well, Dr. Mike, and I appreciate that perspective. I started my career. I have 3 doctorate degrees, and my very first one was in chiropractic, and I practiced as the chief medical officer for fairly large, I would say, chirocentric clinic. Had a number of associates, and I had about every bell and whistle that you could imagine. And one of the things, and this is just me, and I was called a dirty mixer when I went through school at Palmer. I just want to be really clear about that. My modus operandi was, what can we do to help get the patient better without utilizing, aggressive and dangerous therapies like drugs. And I found that when we added in certain modalities, hence the name of the show, people got better faster. I love chiropractic. I love the philosophy. And I'm sure we'll chat about it here on the call, but I want to go to laser as an augment to traditional chiropractic. Because you mentioned a couple of things. Number one, only about 13% of the population utilizes chiropractic services. It's still a lot of people, millions of people every year, but I think that it's underutilized. That's just, again, my opinion point on that. But secondly, I'm fascinated with laser therapy. It wasn't really around when I was in private practice, when I had that large chiropractic clinic. I'd love to hear the story of how does it work with chiropractic? I mean, why does it get people better faster with chiropractic, and maybe without it? I'd love to hear that perspective.
Yeah, so that's also an interesting perspective and a good question, because like chiropractic, right? Chiropractic aligns the body, aligns the nervous system to help the body heal properly, right, and faster. Laser takes it to another level, right? Because now, not only from a patient perspective, they're going to come and see that 87% that won't come and see you, but they're not going to come see you for other things, because they look at chiropractors and they say you are a neck and back doctor, regardless of what the chiropractor markets. That's what they look at when you say chiropractic, back and neck. Becoming a laser pain center and implementing a laser system, you can now do knees, shoulders, elbows, feet. You can now hit all the orthopedic conditions. So when they're coming in, the patients that do come and see for the chiropractic and get their adjustment, now you could have hey, how's your knee? Any knee pain, any shoulder pain? There's adjustments for those, but this will actually help heal the tissue around that from a process called photobiomodulation, right? So you have that, which is basically just stimulating the body to function at a faster rate. It's helping the body dump out more ATP. So it's a natural process. You're just speeding up a recovery. Chiropractic aligns the nervous system. This will actually speed recovery on a specific area, right? So 2 together are a home run. But the other thing is, you'll get people, like I said before, that will come in just for laser that would never see you as a chiropractor because of that negative stigma, right? That is out there floating around, right? I don't want my bones cracked. I don't want my neck cracked. I don't want to hear the sounds. You're going to hurt me. But then you get them in. They trust you. You get them better with the laser therapy model. And then you could put your hands on them as a chiropractor, because then they'll get educated while they're there. So it's also a tool to get these people in the office that would never come and see you and get them into chiropractic.
I love that, and I think that any avenue to help people come in and get safe therapy or safe care and avoid drugs, avoid surgery. I mean, I think all of us in healthcare field, regardless if you're an MD, DO, NP, DC, ND, PA, I don't know how many acronyms we have out there, but I mean, regardless of what you're doing, I mean, that should be the goal, right? Don't put people on drugs. Don't do invasive surgeries, period. Now, that said, I was mentioning this to our younger daughter, who I just want to give a shout out to her, Violet, who does a lot of the social media around Get Better Faster. She's just kicking some booty there. But that said, I said, hey, we're having Dr. Mike on, and we're going to talk about laser therapy. And she said, and I'm quoting her, that sounds dangerous. That sounds like it's going to like, don't lasers like hurt people? Can't they burn people? And she went into this. I mean, it was some really good questions, because she's general public. And I know that, am I right that the laser therapies we're talking about, are they class 4? Is that what we're speaking of with release?
So
walk me through this, like, what is a class 4 laser? Because we mentioned that. And then how, I mean, is it safe? Like to allay the fears of Violet, and everyone else. Tell us about it.
So first thing is to make something a class 4 laser, I believe it's anything over 5,000 milliwatts or 5 watts. You're testing my memory now. I have so many numbers in my head. So if I'm wrong with that, I'll correct it, but I believe that's what it is, which makes it a class 4 laser. Anything under that would be considered class 3B. So also with class 4 laser, there is heat emitted, right? Because of the power of the laser. Now, these are the same type of lasers from a system standpoint that you would use in a medical clinic to cut or cauterize tissue. What makes this different is the wavelengths. What makes this different is the special head. And the way I explain it to patients is that special head and all these lasers disperses the beam. So the way I would explain it would be like, if you're going to power wash your car and clean your car, there's different heads. You put the head to disperse the soap, and the water goes out like this in a spray. But if you're going to break through cinder block, you want to put that needle point beam on, right? Which would be the needle point beam on the laser to cut or cauterize tissue. That's the same type of situation, right? You're dispersing the beam in certain wavelengths, hitting certain tissue differently, creating that photobiomodulation. You get decreased pain, swelling, inflammation, increased healing time. It's a really amazing therapy that's around, which is actually the baseline for everything that we do. I mean, laser is a baseline. We don't now have laser wave. We have laser disc decompression. So we built off of that various things to help our doctors help patients and help heal them faster without drugs and surgery. So it's pretty remarkable.
Well, I think it's really fundamental that you're bringing in the knowledge skill to have somebody understand that this isn't going to hurt you, which I think is really important for people that are, not very, I guess, they don't have an experience, when somebody doesn't have an experience, they let their mind run wild. So I think 100%. It's good to give some guidance to people's minds from running wild as to, this could be painful. This could burn me. This could be, something I don't want to do because I don't know what it's going to do. So I think just building clarity around the system is really important for people to start to understand, like, wow, there's different wavelengths. There's different types of application. There's different types of injury and different types of settings. I think that's the thing too, is you guys because I'm in their Facebook group, I see that there's people constantly asking questions like, what do you do for a knee? What type of settings do you put on for this specific laser model for, a low back injury? What types of settings do you put on specifically for somebody that's dealing with tennis elbow? Like, there's different settings and different frequencies and different levels of the big word you guys use is photobiomodulation is like the frequency of the light. So I think it's really important for people to get that baseline understanding early on in our conversation today, that it's safe. It's definitely a dosage based on application of where the a necessity is. So a knee, different setting, a shoulder, different setting, a low back lumbar disc issue, different setting. So I think that's we should definitely dive a little bit deeper into. But I know Dr. Johnson's over there wanting to jump into.
I want to jump right into that question because it's actually the question that I had queued up next, which is, Dr. Mike, you mentioned, I think very casually, hey, we can treat back, discs in the spine. And I mean, when people blow a disc, I mean, if they go to orthopedics, they're going to get surgery. I mean, it's like, that's what's going to happen. They're going to be given some type of probably a steroid, either an injection, a nerve block, and then they're going to go in for surgeries. I'm fascinated with the idea of using a safe laser therapy to help with disc. I don't know if it's herniations or, partial herniations. I'm fascinated with that. And I get the joint part. I want to dive into that. But also, while we're talking about how we can use this and how patients can benefit and our listeners can benefit, I also want to talk about soft tissue, and muscular injuries or ligamentous or tendinous injuries, cartilage injuries. I'd love to hear more about that as well. So take it away. I want to hear about discs and soft tissue.
So discs are great for this application, especially doing non-surgical spinal decompression with it, because non-surgical spinal decompression in and of itself is great if you do it the right way and you have protocols and systems set up for that. We combine that with laser. So now you're getting the photobiomodulation into that area of injury where a lot of the tissue, usually around the disc, a lot of the tissue is there's some scar tissue in there. There's also a lot of tender tissue from the muscles overacting, the tendons and ligaments overreacting. To kind of keep that place, in that area stable. So we get a lot of people that actually come in that went to their orthos, then go, hey, that they want to do surgery on me, but there's got to be another way. Or they want to do an injection, but I don't want to do that. I want to do something non-invasive. So people are asking for non-invasive treatments to heal discs, right? To get better without drugs and surgery. So it's a great modality. And we actually have laser disc decompression trademarked. So all of our centers do that. And it's a great distinguishing factor becoming a Relief Now laser center. So I'm sorry, I kind of get away from your question, but basically it works so well together because decompression by itself works amazing, right? But there are those tricky cases where you need that extra level of recovery. So now you do laser and decompression at the same time, and you're getting that photobiomodulation, you're getting that analgesic effect, right? And you're also getting that pressure off of that disc. So decompression in and of itself is one of the only ways that's not surgical to actually repair a disc. Sure, there are times when laser decompression won't work, or we shouldn't do it because there's a really bad sequester, or where the disc is protruding down or up, up or down the spinal cord area when we shouldn't be doing it, and we have protocols set up for that. But at the time, that's what we've seen, especially in practice. I mean, I haven't really seen anything like that. Pretty much everybody's a candidate, and they do pretty well. I mean, I would say, if I see 10 people, I would say it's probably 80-90% recovery rate. It may not be 100%, but a lot of these people are at their last thing. They don't know what to do. They can't play with their kids. They can't play golf. They can't sleep. Just to kind of dive into this a little more from a patient testimonial or a patient situation, we had a gentleman come in one time with a walker, and he went through our system, and he went to a cane, and then he went to assisted with his wife. And with this guy, before he came in, he told us, I was taking 4 Oxycontins a night and still couldn't sleep. By the time we were done with our treatment with him, he was on a quarter of an Oxycontin, and he was starting to sleep through the night. This guy literally cried, right? And this is when someone in their 70s. So you see that happening, that you're getting him off drugs, right? Yeah, he's still taking it, but he's in his 70s. And at that point, he just needs a little bit, right? Take the edge off. So you see these things happen, and getting people to get off surgeries and drugs and all these things. And you're like, wow, like this treatment is amazing.
Go ahead.
Okay, sure. Yeah, thank you.
Sorry.
Thank you. Go ahead, Mike.
No, but I wanted to get into So musculoskeletal issues too are great for laser therapy, great for laser wave. We have certain athletes that come in to the practice when I was practicing that would do like laser sessions for preventative. They were extra sore, so they wanted to get it done. Or they bought packages for preemptive. I have a big competition coming up. I want to make sure I have it and book my appointments out. So they're using it as a prophylactic as well as when they get injured, right? So musculoskeletal is a no-brainer. Laser decompression is a no-brainer. Over joints, I mean, we've helped so many people not get surgery for, and I say we, I mean the doctors as a group, right? The success stories that I hear going through our private WhatsApp chat, right? Oh, you have the camaraderie of the doctors always chatting about wins and how they help people and all this amazing stuff. The amount of shoulder surgeries that didn't have to happen, knee replacements that didn't have to happen. It's like a daily thing, and it's just amazing to see this. So there's applications for all of that.
I think that's, like I said, I think it's incredible. In my very early career, going on 26, 27 years ago, I worked primarily with athletes, and oddly enough, I worked with hockey players, professional hockey players, and marathoners. And then that somehow led me into about a year working with professional dance troops, New York City Ballet, Moscow Ballet, Polobolis from New York. And then that somehow led me into working with the film industry in LA just for a brief minute. But all that said, I would hear stories all the time about people that had back surgery. And the story that we hear, and I know that you know this, and I'm going to throw some stats at you, but people that have surgeries, I think the thing that's left out of the conversation, they're going to their orthopedics, they're the best surgeon around, and the orthopedist fails to tell them that somewhere around 40% of surgeries end up being classified as something called failed back surgery syndrome.
There's a CPT code for it.
Yeah, there's a CPT code. There's a diagnosis code for that. That's what a CPT code is. There's a treatment code for that, and a diagnosis code. But 40%, that's a large number. And overwhelmingly, people that get back surgery are going back in for another back surgery within about a decade. So it's not like a one and done type of situation. Like, oh, my back hurts and my disc is blown, I'm going to go in and get surgery, and now I'm good for the rest of my life. You're good for about maybe a decade. And primarily that's because of scar tissue formation. And scar tissue is, the ugly thing that the orthopedists leave out of the conversation when they're selling the surgeries. The scar tissue can sometimes even be more invasive and more problematic than the original problem. So I just want to put that out there. The reason I bring that up is because I don't know this is all new to me. James was saying earlier in the show already that, hey, allay some fears and educate us for the people that don't know anything about, lasers. That's me. Like I said, if it was 26 years ago, I would have been working with you. I want to know about the idea of, I know it's not FBSS, the failed back surgery syndrome. I know it's not that, but tell me about like, is this an ongoing treatment for the rest of your life? Is this a get it done? Talk about the scar tissue involved with laser therapies. Yeah. Thank you.
So, absolutely. So, there's no real negatives with laser therapy, right? there's not a lot, with that at all, really. I mean, if you take the laser and hold it on somebody in one spot for a few minutes, sure, you can give them like a little bit of a burn, but like everyone that's doing it is competent enough not to do that and do it the correct way. Other than that, I mean, there's really no issues with laser. Everything we do in the offices are safe and won't cause harm or injury, right? Because the way people are trained. But going back to, I want to touch on what you said about back surgery. The two people that we really see regarding back surgeries are the people that are like, oh, I don't know, I don't know if I want to get it, I don't know what I want to do, and the people that have gotten back surgery but are still in pain. So the laser is great for post-op, whether it's a month or whether it's 4 years. Because a lot of these people are coming back like, I shouldn't have done back surgery. I shouldn't have been fused. And you can't put the monkey back in that bottle. You have to weigh your options and go, and what I tell friends, family, patients, least invasive first. Do the laser wave, do laser disc decompression, do those non-invasive treatments first. You can always get surgery if you're at that point, right? You can always get the knee replacement if you're at that point. But why jump to the one thing that you can never unwind, one thing that potentially, I mean, I don't want to be that crazy about it, but potentially kill you. Anytime you go under the knife or anything, you potentially die. I'm not saying that happens a lot, but it does. So why go all the way to that extreme when you don't have to, right? It's because you could always do that. You can't undo that.
I want to come in and bang the drum on a couple things. And one of the ideas I want to share with everybody is being a kid. And when we're kids, at least when I grew up, we got magnifying glasses. And if you caught the sun ray the right way, you could terrify and burn ants. But if you use the magnifying glass just as it's supposed to be used, you could use it and you could read small print, which it was intended for. So when we think about the application, once again, I'm going back to the application, and Dr. Jason's asking about deeper symptomatology and different types of like injury and recovery. We're talking about the invasiveness of a deep injury to a recovering injury to a failed injury. So all this is happening, and it's all about the application and the quality of life. And one of the things I always tell people is vitality is very important. And very, very seldom do I meet somebody that's had more surgeries that has a better quality of life and is more vital. Like it's had that surgery that's still doing good after a decade. They're not going to want to get down and wrestle with me because of their vitality is that dude's going to injure me possibly. Or I'm injured or I'm put back together by screws and rods. I'm not going to get down and wrestle somebody that has, they're strong, because that could injure me further. So there's also this hesitancy of vitality when people say, hey, go do that thing on me that I'll never be able to put the genie back into the lamp. So those are some things I just wanted to touch on, because we're talking about some clinical stuff. We're talking about some failure stuff. We're talking about some success things. We're talking about the application. And I think everybody can go back to imagine themselves as a kid with a magnifying glass. And they can think about what it was like to scorch an ant with a direct beam from the sun through a magnifying glass. But I also think that if you use it the right way, you can read better if your eyes are failing you. So light and it's what we're made of. We're all.
Well, I could say the same thing about chiropractic, right? If you use an adjusting instrument and repeatedly hit one area over and over and over and over and over again, I mean, eventually it's going to injure the patient. Or you just take their neck and crank it, right? You can injure the patient. So like you said, it's about using the tool or the
application.
Application the correct way. So I love that.
But I know Dr. Jason's wants to jump in, but
Of course I do.
The organization of ideas here that we're all talking about is, I call it, the issues are in the tissues.
Yes.
And it doesn't matter what the level of injury is, or if you're trying to, like you said, use it as a repair mechanism rather than a recovery mechanism. I think that that's also a very important thing for people to understand, is you can get laser care through the stages of being active without there being an injury, to make sure that the body isn't breaking down, subsequent needing more invasive care. So I think those are really important things. But I wanted to go back because you were talking about people that come in a decade after getting a surgery and they say, hey, I don't want more. What do I do? You're talking about the 70-year-old patient with the cane and the walker and the assistant, like, talk me through like that person that comes through and has like the one remaining genie lamp wish. How does that look like when people show up to you? And what is the process that you take somebody through to tell them that you can qualify them for help or you can't?
The process is essentially the same, no matter if you walk in with both legs or you walk in with a walker. I mean, we're so confident that what the laser can do and the other modalities that we offer with Relief Now to help you, right? There's very little contraindications to a lot of it. That we do the general exam, we do the exam specifically for what we need to do and cover. We go over X-rays or MRIs, and we make the determination. And we even say at times, you're at a point, right? You're 70 years old. You have both knees that are bothering you. Like, we're going to do what we can to help you. But I would say to you, if you're right now at a 9 out of 10, but if we can get you to like a 3 or 4 out of 10, would that be something you'd be happy with? They'd be like, yeah, right? Especially with neuropathy, right? We have a neuropathy program that we do. And a lot of these people come in and, again, it's important to understand that we're not treating neuropathy. We're treating the symptoms of neuropathy, right? So we express that to them, and they go, what does that mean? I go, well, listen, right now you could barely feel the brake pedal. Your toe is like so numb, I could probably rip it off. You would be able to feel it. So if we could get feeling back in there, we get you 30, 40% better, I think that would be a win. And they go, yeah, whatever you can do, because the burning, I can't sleep. So they're at their wits' end at that extreme level, right? It's not like, I hit my knee in the wall and now I have like a torn meniscus, right? As a younger athlete, it's a whole different mindset, but it's about managing the expectation, I guess, would be the only difference differently. Or if you came in with like a small knee injury, I would say, okay, we could probably get you to 100%. But again, like, you have to manage the expectation based on the patient's symptomology, the age, and those various factors.
I think that that's really important for people to hear. Like, that's the sobering idea of doing the show like this and bringing subject matter experts on that have something in their wheelhouse that gets people better, not just mentally, physically, emotionally. But the next step that people don't talk about, Dr. Mike and Dr. Jason, is when you don't feel your feet anymore, now you're a fall victim.
Absolutely.
And when you can't feel your feet and you fall, that's when people break their hips and they don't come back. Yeah. So it's not just the idea that this is a therapeutic model that can get people better faster, but it can give people longevity to quality of life. And I think that that's the thing that we really have to hit home on a show like this, is people get access to something that gives them quality of life and gives life to your years and years to their life better, to where now they're not more fear, more doubt, more guilt, more burden, all the things that come with lack of mobility. And I think that has to be something that is a huge conversation that sometimes we just want to focus on. What do you do, Dr. Mike? How did you become who you are? Well, the outset is that you're helping giving people their families back, and you're helping giving people their confidence back. And maybe they're not going to rear into the next person because they can feel their damn feet. So you're talking about the brake pedal thing. Like, if you can't feel your foot, how do you know if you're applying the brake or the gas? Exactly. So, there's a huge safety protocol in all this too, is quality of life quotient. And that's sometimes something that gets missed when we have like the success stories or the typical cases or the application stories. Is this is real life stuff. And I'm sure there's people out there that are dealing with these things that are like, damn, the orthopedic told me that there wasn't anything else to do but go through the surgery or to get the fusion or to get the thing and to take the pills. So it's really great that I think we're having this honest conversation. There's so much more we're going to get into, but I just wanted to set the baseline on where we are in today's episode and kind of pass it back to Dr. Jason, because I knew that if we didn't like set the table right now, we might forget some of the quality of life things that I think that what you and your laser masters group are doing for people is giving people their lives back.
I think that's so important, James, and you brought up a really good point. If you can't feel your feet, if you're walking around on numb tissue, the chances of a fall is very, very high. And I don't know that people realize this, but when especially in the elderly, when they fall and fracture their hip, right? If we're just talking about that, because that's what happens, right? The chances of dying within 12 months of that fracture is about 33%, 1 in 3. So wow. It's not just, getting people, their life back. It's literally preventing death. So, I mean, this is a really, heavy, I was going to say grave situation. I mean, really that we're talking about. It's a very serious thing. I want people to have less pain. I want people to have, feeling in their feet. I want people to have better quality of life. But ultimately, I think, don't we want people to live for a long time and live a happy, healthy life? Have their grandma and grandpa around, and not falling over and dying and spending the last few months of their life in basically bedridden and unable to move. I mean, this is life changing for a lot of people. So I appreciate that. The other thing that Dr. Mike, I think we talked about it, but I think that we kind of also skimmed over it, and I think it's important. Is this idea of photobiomodulation, and I'm going to break that word down for everybody because we keep saying it. But its application in preventative care and possibly even beyond what we're even discussing right now. Photobiomodulation, photo meaning light. That's what a laser is. It's light, right? It's concentrated light. Bio meaning in the tissue. We're putting the light in the tissue, and then modulation is changing. It's changing the tissue. So photobiomodulation, that's what it's doing. But one of the things that we just kind of glanced over was that it increases mitochondrial function, and in the end increases energy output of the mitochondria. When we talk about energy in the body, we're talking about some specific chemistry. One of the main ones that comes to mind is ATP, adenosine triphosphate. And when we add the laser in to do the photobiomodulation, changing the tissue, it actually increases the mitochondria that live in all of your cells. It increases the mitochondria output of ATP, of energy. So we're actually increasing the amount of energy that people have in their body. And when you increase the energy, when the mitochondria respond and they're producing more energy, guess what? Your body can heal quicker. And the whole point of this show is getting people better faster. So I love the idea of treatment, but again, I think we glanced over this idea of, I'm going to call it preventative care instead of palliative care. Palliative meaning treating a symptom. It seems like, and maybe I'm wrong, maybe I misread it, so please correct me if I'm wrong, but it seems like there could be an application for preventive medicine in this as well.
Correct. And that's kind of what I touched on before with some athletes. They know the power of it. And, if they have a race, they'll get their hamstrings done or their calves done prior. And sometimes, when you're close to it, you do gloss over it, right? Because you get so close to it and you go, okay, I already know this. So you don't break it down like you just did. And that was great. But yeah, we do people that use it for preventative all the time. It's not sought out as much because really people only care to do things a lot of the times when they don't feel well or when they're hurt, right? They don't put the work in and day out, and it's, told they need to. But yeah, this is definitely something that could almost like biohacking is huge right now. This could biohack your tissue in those areas that you're going to stress over the next, marathon or triathlon or whatever. So yeah, it's definitely something that could help preventatively.
James, go ahead. I have a couple other follow-up questions that are related to this, but go ahead.
Yeah. I'm more curious about somebody that has like a scar. You were talking about scar tissue earlier, and I definitely don't think like we finished that conversation. Most people think of scar tissue as something that's around the injury internal, but I'm talking about like if somebody has like a scar, like say they fall on concrete and their skin is healing. Are there settings on the laser that can help people heal from like abrasions or like a scalpel per se, and heal up the tissues faster to where the body that has the scabbing effect or whatever we want to call it, the healing effect? I'm not a doctor. I just know it as a scab. Like, is there a protocol for systems that can actually heal people's scarring and scabs and scar tissue externally faster?
So yes, but to clarify, it won't actually, like if you have a scar already, it won't make the scar go away. What it will do is it will decrease rigidity of that tissue and help it more elastin, and it'll break up some of that scar tissue so it's more pliable and more elastic and less pain sensitive. Now, someone that has like post-surgical, it's a great option. As soon as you take the bandage off, it's something that you definitely want to do, because there are settings to reduce some of the actual heat feeling, and you can still get the same benefits of the wavelengths that are going to the tissue, helping the tissue to recover and participating in photobiomodulation. Prime example, actually, my partner, Dr. Rob, he, tore his Achilles, I don't know how long ago it was, during the pandemic time, right when we started doing this and laser and everything. And it was one of those situations where you had to attach it back to the bone. So there was a minor surgery that had to happen. Like laser's not going to attach it back to bone. Right. So he had to get it attached. But after, immediately, he started, as soon as he could take the bandage off, he started doing laser on it every night. And either the PT or the ortho, I forgot who he was seeing, maybe a little both, couldn't believe how quickly he recovered. It cut the recovery down, I think, by like 40 or 50% of time. And he was back to doing CrossFit. So, you see something like that, like if people just got out of their own way, if doctors just got out of their own way and said, hey, something we need to do to help our patients, or we need to do to help myself, people, would do a lot less surgeries, a lot less drugs. That's the whole mission.
I think that's amazing. And I love the idea of cutting it down 40, 50% for healing time. And I just want to give some perspective on this, not necessarily Dr. Rob in this specific case, but the recovery time from I'm going to throw some stats out there again. I think that we figured out the way I like to do this interview today. I'll throw some stats out there, and then we're going to move it over to laser and compare. Back surgeries, if we're just talking about back surgeries again, recovery time is like 12 months. I mean, it's a long time for, a recovery. And that's if things go well. The other thing is, I don't know that people realize this, because we are all under the delusion that insurance pays for everything in this country. Although if we look at the number one cause of bankruptcy in this country, it's from, medical debt. And ultimately, a back surgery on the cheap is going to be around $80,000 and even up to like $180,000. It's a lot of money. That's a huge investment, especially for a 40% fail rate and a definite returning, almost definite. I can't say definite, but an almost definite return to get another one of those very expensive surgeries within a decade. So it's a long recovery time. As James was mentioning earlier, once you've had it, and I think Dr. Mike, you said it too, when the genie's out of the bottle, you can't put it back in. You're not going to get down and wrestle. I mean, after a back surgery, no one's going to say, now I got down and wrestled with my grandkids, because you got to be careful. I think laser is very different. So my questions are around this, because it sounds like, again, I don't have experience with this, but it sounds like a procedure that you kind of go in and you get done, and it helps, and it probably accumulates, with the more treatments that you get. I'm making some assumptions there. I'm going to give you some laterality to talk about that. But there's not really a downtime. If I'm understanding this, it's going in, it's doing some work, and there's probably something that you need to do. But walk me through here's my questions. Walk me through the recovery time.
Sure.
Walk me through how many sessions or treatments do people get for the average, like, let's just keep comparing it to back surgeries, because it's so prevalent in the United States. Walk me through the cost. Just
Sure.
Generally, and I understand that, in different areas of the country, there's going to be different, price points. But yeah, recovery time, number of treatments, and the I don't like the word cost. I'm going to say investment.
Investment in your health. Right,
yeah, the investment in your health. Yeah, tell me about that stuff.
So the first one about treatment time, right? So, we have a standard protocol that we do, and we could go back to the whole back situation. But again, patients will start feeling, some will feel it almost immediately, depending, again, there's a lot of different factors here, because there's a lot of variables, right? So usually with back surgery, it's a little different, because they kind of have you come in with this issue, we do this procedure, and it's like, this is how we do it. And it's very medical based. When we do laser, you could have a similar back injury, but it could be musculoskeletal. It could be a disc, which will treat musculoskeletal differently than we'll treat a disc, right? Versus if it's like a fracture of something on the spine. So that right there changes it up. But if it's just like, let's say, a musculoskeletal, low back pain, the patient may feel a little better or some sort of improvement from a decrease of pain situation within the first treatment, maybe two, right? So there's that. But again, to actually feel like 90, 100%, it could be 6, it could be 10. Everybody is different. So we have our protocols that we put people through. And like, I tell the doctors, doctor, be the doctor, right? But we have our protocols that we say, this is what we abide by. And, every patient may respond differently, right? Some may take a little more time, some may take a little less time, but it's not like you go in for a surgery and like this. It's like, all right, we'll do our standard of care or our initial procedure of laser treatments. It's this. We'll see how you're doing. We'll do some tests. Okay, we maybe need a few more. So that's how that differs. And they may feel a little better within the first treatment. It really depends on the patient. I've had patients, it's crazy. I tell this to patients too, just so they're aware, so what they can expect. I tell them that I have patients that will feel better, at least a little bit, after the first treatment. I have patients, it takes 20 treatments to even feel 50% better. It depends on the person and how bad and far along they are.
I'll say this too, being in practice for 26 years, the main variable is the human being that's getting the treatment, it's getting the procedure. Because people have treated their bodies differently. Some people eat, purely organic and they're protein forward and low glycemic load, this and that. Other people haven't done that. They're eating McDonald's every day. Some people take supplements that are anti-inflammatory. Some people don't. I could go on and on. There's so many variables there. But what I am hearing, just to clarify for our listeners, this is not a go in and get, so you get some treatments, 1 to 20 treatments or however long it takes. It doesn't matter. They're able to walk out. They walk in.
Non-invasive.
Yeah, it's non-invasic. So
no downtime. So I didn't answer that. There's no downtime. Yeah, you can get back out your day.
Right? Because with the back surgery again, if we're talking about like disc herniations or H&Ps or something like that, people they're wheeled out. They're not walking and getting in their car. There's assistance involved. And I think that's fascinating that, for myself, this is just me. I would rather go for 50 treatments, 50 micro treatments to alleviate whatever it took rather than going under the scalpel. Because as we know, iatrogenic problems or problems that we create with medical procedures are literally at least, and I'm going to have some criticism over this because I'm going to go too low, are at least the third leading cause of death in this country, following only cardiovascular disease and cancer. So, when we think about iatrogenic or doctor-induced, medical death, it's the third leading cause of death in this country, at least 250,000 people. And that's not me making stuff up. Please fact check me, listeners. Go to the British Medical Journal, go to the Lancet, go to New England Journal of Medicine, go to JAMA itself. They all say the same thing. It's about 250,000 plus people a year. So again, I don't want to risk my life, this is just me. I don't want to risk my life. And I've been in serious pain. I have abused my body. I have not taken care of it. I've been in accidents, car accidents, mountain biking accidents. I've broken about everything that you could imagine. I'm not going in for that surgery. I'm not taking those drugs. I'm going to go in and get something like this done. Okay. So all of that said, I like you're able to go in, no real recovery time. It accumulates. You mentioned, some people it's 20. I know we're just arbitrarily making up numbers here. It could be 20 visits, but on the average, let's say it's a disc case. And again, I had mentioned that from a general medical, procedural cost in the United States, we're looking on the cheap of about $80,000, and it could be even like triple that. I don't want to make any assumptions, but I'm hoping that these laser therapies, even if they need 20, 30 visits, probably is a little bit more affordable. Can you walk me through that?
Yeah, sure. So if someone comes in one of the clinics to get laser disc decompression for the protocol that we use, depending where you are in the country, we have recommendations for our doctors. So, you could be paying, 35 to maybe $7,000, which is a fraction of the cost and the lower risk, right? Of going, so it's 2 wins right there. It's really a no-brainer.
Dude, most people have a 20% copay or coinsurance. If you have an $80,000, surgery, you're going to be paying, 15, 20 grand out of pocket for that anyway. I mean, this is like me, this is a no-brainer. But I think in these terms. I gave up on relying on insurance, years and years ago, because we pay more and more. Everybody knows this. We pay more and more every single year, every single month. We're paying more and more. They cover less and less. Everything has to go through all these gatekeepers. Nothing's ever approved. And doctors spend all their time just fighting for $14 rather than getting people better. I love this approach. And even if it was 10K, it's a fraction of the cost, and it's like a non-risk for the most part. James, I saw your finger up there, so I'll pass the ball.
Just listen to the organic conversation today about the case management, the incidents of how to use the application of this. And now we're talking about cost-effective strategies. Like, if you told somebody in 2026 that you could spend $3,500 on something that was going to change the dynamics of their life for the next 20 to 30 years of their life, like you waste $3,000 a month on something. I guarantee you the average American is wasting $3,000 a month on something. So if you could reformat those funds into something that's actually going to help you, preventative or the capacity of recovery, now we're talking about a game changer that keeps you out of the medical matrix. 100%. I think that's the response. See, that's what I love this show for, is it gives a chance for responsible conversations, to give people the idea that it doesn't hurt you. There's no downtime. The apples to apples cost is super low. And actually there's people out there that want to help you. Like, that's the other thing that I really love about what you and Rob are doing, Mike, is you guys are giving people all of the resources, and the chiropractic people that you're helping with this, the doctors or other practitioners, they love it. They're so in love with their practice model. They're so in love with their clinic model. They're so in love with their brand. They're so in love with their community. They can't wait to go in and to provide these services to people and to exchange cash services. This keeps more money in the good guys' pockets and it puts less money into the bad guys' pockets. And I think that that's something for people to also take in consideration. Is I'm not saying the insurance people are bad guys, but I guarantee you people that are taking insurance, they're not making more money for the practitioners. They're making more money for the method and the machine behind it. So it's not actually making more money for the practitioner when they take insurance. It's actually making more money for the insurance system. So absolutely. That's the part that people have to be really clear on too, is when you're actually paying into a system that doesn't provide real health services, and you can't go and pick and say, hey, I'm going to pay my insurance, and now you guys are going to cover my organic food. You're going to cover my gym memberships. You're going to cover my parks passes. You guys are going to cover my athletic trainer. You're going to cover my PT, like all the things. It doesn't give you that option to check that box. It only goes towards recovery from pills, potions, or lotions or surgical interventions. It's not going to give you the idea that it's actually an insurance policy for your health. It's actually an insurance policy for your last ditch effort for recovery. And this is what we're going to give to you because this is how we work. So I think it's just important for somebody like me, it's not the doctor on today's call, to say, look, there's a lot of confusion around what is covered, but also the cost per doing business in 2026 for staying healthy is much different than it was a decade ago. So the responsible question people have to ask themselves is laser therapy right for me? And damn, how can I go get a special package with one of these offices? And I want that type of thing for me and my family. And I don't want to pay a premium, and I don't want to pay for some high ticket thing that, like Dr. Jason's saying, the third leading cause of death in America is, I don't even know the word, iatrogenic issues. And I think that that's the waterfall effect that people don't understand, is once you start, it's like you open up Pandora's box. You can't put the genie back into it. So I think that's just really important for me to have that responsible conversation for the listener to say, look, cost of doing business today is much different than the cost of doing business a decade ago. And Dr. Jason even gave the details. Cost of doing business for an invasive procedure is much different today than it is to be more, even 50 times going for laser treatment is better than one time where we were rolling the dice and we're coming back in a decade for the same thing.
It's never going to be one time. It's going to be multiple times, you know, and I think I think what you're saying, James, is so important here. And I'm not going to unpack all of that, but I think it's so important that we understand that, again, the insurance industry and all of that. Here's what I say. If people were going to find the solution that they're looking for within the system, they would have found it by now, you know? And I mean, it's so then we have that little nugget that people need to own that. And as James was saying, within the system, it's geared to make the insurance companies and, I'm going to fill in the blank here, but the hospital associations really is what it is. You know, mega bucks. It's not even necessarily the providers. The providers are mostly employed by those agencies. They're either employed by an insurance company like Kaiser Permanente over on the West Coast, or they're working for a hospital association that's also basically under contract, and they just get paid a salary. Which brings up a question, Dr. Mike, that I have.
Sure.
I already and we've already answered it. We've already answered. Oh, I wanted to say one more thing before I ask the question. You remember how I said like the number one cause of bankruptcy in the United States is basically medical debt? You know what I've never heard ever in my life? Man, I had to declare bankruptcy because I invested so much in my health. I've never heard anybody say
Never
that
heard it either.
ever in my life, you know, and I've been in this industry for, 2.5 decades plus in practice, and add on another half a decade in there in training plus, you know. So I just want to throw that out there. But here's my question, Dr. Mike and James. We've already answered it, but I'm gonna let you guys like really speak to it. If this is so effective and it's so cost effective, why aren't we seeing it in mainstream medicine?
Well, I could touch on that because people that get better aren't customers.
Ooh.
Right? I mean, if you get someone better in a series of treatments that avoids the insurance model, because all of our centers are private pay. So you're avoiding an insurance model, and people are getting better, right, at a large, capacity based on, again, based on all anecdotal people that I talk to, I've seen in my clinic when I was practicing, see in these doctors' clinics, people are getting better and not needing surgery or drugs. It's going against the medical model, right? And they don't want that. Although I have to say, we are getting some like-minded orthopedic doctors now involved in what we do, and they're going, this is important to do. They share
Awesome.
that. They brought on a medical director to help with that as well. So, they're seeing the light. They go, wow, like this is a better way to help patients. So that's my 2 cents on that.
And they're not all bad guys, like you said. I mean, there's some good people out there doing really good work, even within the system. Sometimes they have their golden handcuffs to a certain extent, and they don't get to make those types of decisions. But I think that's cool that we're seeing it. James, sorry, go ahead, sir.
Yeah, I just wanted to touch on that too. And you've heard me say since we've done 50 or so episodes of the show is there's no money in healthy people. But the thing is that quality of life is more important than a dollar. And I think that that's the part where we've really missed the mark as a nation is we've put procedures and big buildings and big titles ahead of quality of life. And that's where we've really lost the game, in my opinion. That's why I've supported chiropractic for the past 17 years, is because I saw that chiropractic actually put people first.
Mm-hmm.
And they actually put the value of the human in front of them before the numbers. And then they had to go into this idea of explaining to the patient the value of care in exchange for their credit card to get swiped or their bank card to get swiped. Whereas if they went into the other model, they don't get that conversation. They just get a bill that gets pushed through the system, which whether they want to pay it or not, at the end of the day, they don't have a choice. And that's why we're seeing these really malicious bankruptcies, because people don't have a choice in that system. the thing I saw about the payer first model with chiropractic was we have to have this responsible conversation with the person in front of you saying, hey, for 26 visits, this is what we got to charge you. Hey, for 12 visits, this is what we got to charge you. This is our 1 visit fee. This is our 2 visit fee. This is our 5 visit fee down the line. So it's always been a responsible patient first conversation rather than system first bully. You have to go do this. If you don't do this, now we're taking everything from you. So I always loved chiropractic because it gave people that idea of affordability model. And then they're saying, well, I can't afford that, and that's all perception, because now we're talking about the far end of the spectrum where if you don't pay for quality of life now, you will have to become a customer of this other system later. It's your choice.
I agree. You either pay for health or you pay for sick care. I mean, it's one of those two. I mean, I've been doing this for way too long, and I've seen everything that you could imagine, from athletes that just want to be better athletes all the way to, Hail Mary passes with cancer. And I've seen success all across the spectrum with that. And I think the people that, like I said, invest, they step out of the system. There's a time and a place for everything, guys. I mean, if you're hit by a bus and you're bleeding out, please go to the ER. It's probably not laser at that exact moment, but after you go to the ER, after you go to the ER and get all patched up, there's time and a place for other things, right? But I think ultimately, I mean, what we're discussing is something that's important, because again, there is a lot of sales, and not just, I don't mean dollar sales, I mean sales between the ears, selling us an idea that there's some third party out there that has your best interests at heart. And there's not. I mean, and the thing is, I mean, we all know that. I think inherently we all know. I know that Dr. Mike, you said, insurance companies aren't evil or something like that. I've actually had some really evil conversations with I used to work for insurance companies. They paid me really well. I'll just throw that out there. And I don't know, a few years into the game, I got really disgusted by the conversations I was having within my utilization reviews. I won't bore us with that right now, but being told what I can and can't do, what's, other, policy people making decisions based about what the patient actually needs or could benefit from rather than what they actually need. And people that don't care about anything beyond the bottom line. Like I said, there's good people in the system doing good work, but I mean, in my experience, they're fewer and further between the longer we go down this road. But anyway, here's my question, Dr. Mike. We've talked about things that, we can help, disc herniations. We can help knee injuries, even if it's only reducing the pain by 75%, people, that's a big deal for people. Here's my question. What about, is there any contraindications to getting laser therapy, to getting laser care? What I mean by that, is there anyone that should say, like, man, that sounds really good, I'm going to go to getbetterfasterpodcast.com and I'm going to connect with the links to get connected with Dr. Mike and the Relief Now laser centers, where the closest one to me. So getbetterfasterpodcast.com, we'll have all those links there for you guys. But is there someone out there that's like, maybe this isn't for me, maybe this isn't the right match?
Well, so there's a few. There's also a list of not full contraindications, just stuff that they recommend. But the main contraindications are active cancer in the area being treated, pregnant, right, and over growth plates as a child. But for me, which all makes sense, like logically, right? My daughter recently fractured her clavicle, right? She's 5, right? So I've been doing laser over her clavicle to help with pain reduction, help it heal faster, so on and so forth. So I believe in laser so much that I'm putting my daughter, who's 5, under laser. Again, it's a different protocol. It's a different amount of time, right? Tissue on a 5-year-old is much less dense than, someone that's in their 50s that's 30 pounds overweight. So it's completely different how you apply it. One tool can be applied to various things, just you have to do it the right way.
And that makes a lot of sense because, again, if we go back to photobiomodulation, we're increasing the mitochondria production of ATP and energy. I mean, if you think about things like cancer, I don't know that we want to increase the energy around a cancer. I mean, that makes a lot of sense. I don't know that we want to increase the energy around a growth plate because, again, it's going to close that growth plate. Possibly. I'm not too worried about that myself, but I get the risk in pregnancy. Everything's contraindicated with pregnancy.
Exactly.
I mean, because here's the deal for everybody. We can't, and it makes sense. We can't do randomized controlled clinical trials, RCCTs with pregnant people, because we can't be like, we're gonna see what happens if we do this. I mean, we don't know, and it'd be probably unethical. But all of that said, I think that's fascinating. Yeah, so thank you for sharing that. But otherwise, it sounds like a safe therapy that people can go in for. They're going to walk out. They're going to probably feel better within a visit or 2 or 3. Might take a few more depending on the situation. But I don't really see a downside to it. So I really appreciate that. I'd love to hear, we talked about, I also wanted to say, you said that your daughter's 5 and you're treating with laser. I believe, yes. And I believe in chiropractic so much. I don't know if I've ever told James this, but when our older daughter, Adeline, was born, she got adjusted within about 1 minute or 2 minutes of making sure she was okay. And she couldn't turn her head. It was clear that she had been born with some shoulder dystocia, some torticollis, or she just wasn't moving well. And it's a different, like you said, it's a different, I don't know if this is the right word with laser, but different amplitude, right? It's a different force, so to speak. I mean, when you're adjusting a little baby like that, I mean, it's just fingers. It's not like a big thing. And you know what? I'm so glad that we did that, because she's healthy. She's like the healthiest person I know now at 25 years old. She's athletic, she's adventurous, she's brilliant. I could go on and on. And not to discount our younger daughter too. She's also all of those things. But anyway, I just wanted to throw that out there. I'd love to hear a story of someone who came to you through the conventional system, and they're, and it either worked or didn't work, but it wasn't what they expected, and they're still dealing with whatever they went in for, and they don't want to have another surgery, and they don't want to take any more opioids. They don't want to take NSAIDs because they're, destroying their gut and causing, gastric bleeding. They don't want to take, paracetamol, acetaminophen, because it's destroying their liver and their detoxification. It's making them very, very sick. And they come to you and they say, Dr. Mike, what can I do? And I'd love to hear a success story, like your banner story. I'd love to hear that.
So, this is the one I always tell. There wasn't a surgery involved, but she was going through the medical system and nothing ever helped her, right, in the past. And then she heard about laser through a friend. And this is when we were really getting into it. Like, I maybe had a practice at this point, like, I don't know, 3 years. And I was really getting into laser then in the practice before even Relief Now started. And we were talking, and she came in one day and she's like, hey, I heard about this laser thing you guys are doing. My friend came in for a little back pain. I mean, she was in, she had an antalgic lean to the left, couldn't sit on her right butt cheek. I mean, almost crying when she came in. She's like, you think it'll work for me? And in my head, I'm still 100, I'm not 100% sure about laser at this point, right? Elo, I see people getting help, but it was like, not like yeah, no problem, we got you. It was more like I think we can. So she came in 9 or 10 out of 10 pain, antalgic lean to the left, which means she had pain going into her right. So she had to lean left to compensate for the pain. She couldn't sit on her right butt cheek. She laid down. It was her low back. That was the pain going into her, I think it was right hip and glute. Did one treatment on her. She gets up and starts crying. I'm like, oh shit. Like, what do we do? And she gets up, stands up straight. She's sitting on her right butt. She sat on her right butt cheek, started doing one of these, stood up straight. And in the process of all, she was crying. And I was like, is everything all right? She's like, I can't believe it. I'm like at a 3 right now. She's like, and she's like, I was so worried that I wasn't going to get any better from just one treatment, because I have to go. It was a Wednesday, because I have to go on Friday. We're leaving for Orlando with my kids, and we're going to do a lot of walking. And I can't go like how I came in. So the tears were tears of joy, because now she can go on this trip. And that like solidified a lot of what we do with laser and how far it's come, and go, wow, like there's really something here. That's when it clicked for me. And that's the story I tell everybody when they ask that question, because that one event for me paved the way for everything that we have done now for me, and it's wild to see stuff like that happen. So that's my story.
I think it's really great that you share that. There's a lot
absolutely.
there's a lot of seriousness in what people are looking for in this world.
Mm-hmm.
One of the catchphrases I always tell people is most people just don't know where to go or who to trust, and it's true. If people knew what we know, they'd do what we do. And if they had a 5-year-old with an injury, they would take their 5-year-old to get the laser, and I think one of the things that Dr. Jason was saying earlier was about the quality of life for somebody that's been adjusted from birth to young adulthood. That's also something that if people know what we know, they do what we do. If people knew how important a functioning nervous system was with chiropractic adjustments, um, they would need less invasive therapy as they age. And, I'm not a doctor, but I'm just going to tell people that if you get adjusted regularly and at a young age into old age, you have less dysfunction and musculoskeletal issues, and your nervous system functions at a higher level, and you sleep better and you have better mobility. So there's a lot that goes into having the maintenance effect on anything that we have, whether it's our bodies, our homes, our vehicles. The more maintenance you put onto something, the better it stays healthy and looks better and functions better. So that's one of the things too we have to really understand about human dynamics is the more that you're considerate about maintenance on your body from early age into old age, the better you age. And that's once again this vitality model. It's not just musculoskeletal model, but you can't separate the two. And when you have a more vital musculoskeletal system, you have better quality of life long term. So I think just tying all that up for people is a really responsible thing as we have the conversation today, is to let people know that like earlier that you start taking care of yourself, the better your life turns out longer term. And those are parts where we kind of gloss over of like, yeah, do this and life gets better. But no, do this now for the rest of your life and life will remain good. And the day that you take your eye off the ball is the day you miss it. And I think that that's really important for people to take home. But we're talking about you first, this story you just shared, this lady that walks around Orlando now with her kids to the amusement park. How long ago was that?
I want to say, let's call it 7-8 years ago at this point.
Okay, 7-8 years from now, where's this laser world going?
I would love to keep touching more people the same way, but from a company standpoint, right? So the more doctors that we have that subscribe to the mission and the model, and it gives us more reach, right, to help more people and push the mission to ditch the drugs and skip the scalpel. I mean, I would like to be 200, 300, 400, even, doctors who join the mission, join the group, right? That'd be amazing to hear that and have Relief Now laser, or Relief Now as a whole, as the main source where people go for non-invasive treatments, right? Like to make like a household name for laser, or even laser wave and laser disc decompression, like that people go like, oh, you're going through Relief Now Center, like stuff like that. That would be amazing to see that brand really flourish within that space and be a household name.
Yeah, I look forward to the day when we have a Relief Now laser arena.
There you go. That's big thinking right there.
That's awesome. I love that idea too. Hey, which I have a question.
Sure.
I think it's a basic question. You said you'd love to see, some hundreds of doctors, doing Relief Now and all these centers around. How many doctors are trained, and how many relief centers are there? Relief Now centers are there around the U.S.?
I think we're closer to 60 at this point. Mainly East Coast. We have one in Dubai. So they're kind of all over, and we have a bunch that are we're talking to right now. So hopefully we can keep pushing this mission as get and expand as quickly and as possible to help more people. That's really the whole reason behind this. And it's really amazing to see that the results the doctors get, the way that they now position themselves, adding that additional laser clinic to their practice, right? The two practices, one roof model, and really getting that population that never come and see them. And then a lot of those patients, they can then educate and get them to be chiropractor, get them to see a chiropractor and get and understand chiropractic versus what the news always says and the negativity. So yeah, that'd be awesome.
I have a follow-up question, but actually we're going to jump to comment that we had from one of our listeners, Jan, who I know very well. She said she's a patient of mine. And thank you for saying I've helped her tremendously. I do love that. I won't share a whole lot about Jan's case, but what she said is, I'm 60. I've had 3 back surgeries because she was told it was her only option. See, guys, I'm not making this stuff up. People don't just have one. It's like Lay's potato chips. You can't just have one, right? But I had 3 back surgeries. I was told my only option. I still have pain at times in my butt and down my legs. Would laser help?
Absolutely. I mean, I'm at the point where I can say absolutely, at least a little bit. And yet, listen, there are some patients that we can't help, but you won't know unless you try. And for the least invasiveness as laser is and the benefits that it can offer, invest in your health and try. That's all I can say.
Yeah. And I'll say this to Jan, since again I know her well. We've worked together for a number of years. She's doing great overall. Jan, if you reach out to me, I'll help connect you with somebody that's in your area. So and I'll work with Dr. Mike on that. So there's that piece I wanted to cover. But I want to go to we talked about, there's like 60, 70 clinics around the country that are doing this, some internationally, which I really appreciate. So let's just say there's a chiropractor listening to this right now, doctor of chiropractic that's listening to this show right now, and they're thinking, man, I get great results with chiropractic. I'm good at what I do, but I can see that there's a glass ceiling here. And I think that this might help me break through that and help even more people in either, putting it all together or even standalone therapies. What's it like to be that doctor of chiropractic, to be like today to, I got to get trained, I got to learn all this stuff and learn all the protocols and then open my laser center. What's the training like?
So the question you're asking is how long is the onboarding until they can really be implemented?
Yeah, that's what I'm asking.
Yeah, no, I just want to so I would say 90 days, 90 to 120 days, depending on the speed of the doctor. That's our onboarding process. Some doctors can move a little quicker, but generally it's a 90-day process. But again, the doctors that are like, I'm busy, I have patients, it really depends, right? We're on the doctors, we try to push them along. So it's about 90 days.
That's great. I mean, it's a short turnaround. I mean, really. And what's cool is, I don't know that people know this, but doctors of chiropractic have essentially the same training as any medical doctor or osteopath or anybody these days. I know that the medical profession does not like us to say that. They like to act like they're the gold standard of everything. But I mean, they don't have any special training that anybody else doesn't have. They just own the game, so to speak. I have another question, a follow-up to this.
Sure.
So as you mentioned, you guys, or James did, I'm not sure who said this, but you guys are basically refining the protocols. You're refining the onboarding, the training processes. You've been doing it enough now for so many years with so many doctors and thousands and thousands and countless patients, around the States and internationally, that you kind of know, what works, what doesn't work, and how to tweak it. I think that's brilliant. I'm going to pause and come back to that idea. Sometimes I hear from my clients, and again, I'm not in chiropractic practice anymore. I do functional internal medicine and primarily focusing on helping people with Hashimoto's and other thyroid autoimmunities, hypothyroidism, get into remission, and not have to take those drugs anymore and how to reclaim their life and their health and all that. All that said, I still get questions, what should I do for pain? And of course I say things like, you should go to chiropractor. And I get a lot of feedback. Sometimes they're like, I have a great chiropractor. I'm like, well, go talk to that guy. Other times I hear people say things, and I'm sure you've heard this before. I know James has heard this before. James has, helped schedule personally almost 12,000 new chiropractic patients with his marketing practice. I mean, he's brilliant at that. What we hear is, well, I went to a chiropractor and fill in the blank. It didn't work. It got worse. I mean, there's just
a negative comment. Yeah.
Negative, right? And I always say, you know what? Go to someone else. I mean, it's one of those things where, you can't, judge the entire profession because there's, somebody out there that's just doing a crappy job. I mean, there are different skill sets with different people. I mean, and that's not just true for chiropractic. That's true for every single profession in the entire world. I can't tell you how many accountants I've gone through in my life as an example, right? I mean, there's good people, there's bad people.
In every profession.
In every profession. So coming back to laser, you guys are refining it. You didn't invent it, but you're refining it. I'm sure, I don't want to put words in your mouth, but I'm making some grand assumptions here. you've had to have heard in, the last decade, well, I went to some guy doing laser and it didn't help at all, and I spent a bunch of money. How would you respond to that?
Well, firstly, I've had patients like that. They used to come and see me. Oh, I did that before. Yeah, but did you do it the way that we instruct our doctors do it? You see the way that we do it. It's a completely different process. It even goes for like patients that go, oh, I've done decompression before. Well, have you done it the way we do it with laser? Oh, no, I haven't. Okay, so you haven't done it before. So it's like there's good and bad in all professions. You could say, oh, I had a plumber before, but if you break a pipe and that plumber was bad, you're not going to get another plumber. You're just going to let the water flow. Right. But you gotta figure out, there's other people that may offer. It could be a 1 degree turn or a 1 degree tweak that one doctor did versus another to make all the difference in the world. People need to understand that just because you had it, you think you had it before, doesn't mean it was the same thing.
It's interesting because, I make this joke all the time. I was very blessed in 2023. I wrote a book, it became an international bestseller. It's in fact right here, the Epic 5 plan. Go to Amazon, pick it up. If you have Kindle Unlimited, it's completely free. You can just download it. If you want to listen to an audio version, it's there too. I'll just keep promoting it. But the point is, the Epic 5 plan is about, proper hydration with electrolytes, healthy diet, eat real food for the most part, protein forward, low glycemic load, move every day, work on your nervous system regulation, and the practices there. And then, get some good sleep. If I had to write it again, so those are the 5 pillars. If I had to write it again, I'd also add in a 6th pillar. And it would be about community. Surround yourself with, loving, supportive people that are also health-minded. And I think if people practice these 6 things, they get better. And the reason I wrote that book is because I found myself telling my chronic illness clients, these same things over and over and over and over again. And I just decided to write a book and say, hey, do these 6 things, and then we'll help biohack you the rest of the way, right? And we'll support you with your changes. The reason I bring all that up, and from apropos to what you were saying, we used to have people that would come in and say, well, I went gluten-free, or I, didn't do dairy, or I tried, I tried to drink more water, and I tried, all this. And I had a wonderful office manager that has since moved on. But she said, have you done it all at the same time? And they would all just look blankly like a deer in headlights. Like,
yep.
No, like I haven't even, it's like they hadn't even thought of that thing. Like yep. It was like too big of a concept, and I love the fact that you said that, because it's like, well, yeah, I've tried this, I've tried that, but have you done it at the same time? And again, you get that deer in headlights look. And I mean that out of love for everybody. Health has become complex, as James keeps saying on our shows. When I got first into practice, 25, 30 years ago, between my residency and then private practice, it was very different returning someone to a baseline of health than it is today. We are under a barrage of endocrine disruptors that disrupt our hormones, immune system disruptors that disrupt our immune system, neurological disruptors that disrupt our nervous system, and all of them kind of lead toward one inflammatory pathway. And more people are under pain, having pain. If you complicate that with metabolic disorders, we have the neuropathies that are showing up with different metabolic disorders. And what I love about this is, in the not too long ago days, everybody was treated with opioids, and we still unfortunately have some doctors prescribing opioids. The opioid crisis, the epidemic was so big that, I won't get into the politics behind that, but there was one family that was behind that for the most part, and they were just pushing
family. Excuse me.
Yeah, exactly, right. Pushing those opioids to the doctors who were, getting huge kickbacks. What I love about it is that by removing the opioids from, mostly from the front line or the first line of defense, it's really opened up questions for people, because again, we don't really have a lot of other, options in the standard medical world. We have prednisones and other types of steroids that suppress the immune system. So, hey, your pain's better, but guess what? You're at risk of dying from the common cold, and you're going to get cancer probably if you do it for too long. Same thing with biologics. We talked about NSAIDs, whether it's aspirin or ibuprofen, naproxen sodium, Celebrex. I mean, I can go with some prescriptions there. They're going to tear up your gut eventually if you keep taking it. You're going to bleed. People have GI bleeds all the time. We pick it up on our GI studies that we do. I mean, people have occult blood in their stools all the time. It's so common, in fact, that with having blood in the stools that it's like no big deal anymore in general medicine.
Wow, really?
Has it. Again, we have paracetamol and acetaminophen that are blocking enzymes in the liver that are causing liver failure. In fact, out of all the drugs that are out there, besides maybe opioids, Tylenol has a massive risk of complications if you take too much of it. It'll kill you very, very, very quickly. Please don't mix it with alcohol, especially. So when we start looking at the options that are out there, there's not a whole lot, right? So it's really opened up a window for things like the laser therapies. And I'm wondering, finally, I'm getting to my question. Thank you for letting me always have context, everybody. When this window opened up, so opioids bad, no more opioids. Don't put the family in jail. Just take a little bit of their money and let them still be, super millionaires. But anyway, that's political and besides the point. When that window got closed and nobody wants these other things, did you see an upsurge in the utilization of laser, or at least an interest? I'm curious.
I wouldn't say there's an upsurge utilization of laser. I would say an upsurge of people seeking out different modalities or different ways to get better besides drugs and surgery. So now people are seeking out how to not go under the knife. Like they're searching for it, how to not, take this pill, or what else can I do before I do this? So they're more educated. And now with like all the AIs and stuff, people are becoming much more educated. They're not, I don't want to say stupid, but they're not, they're more abreast of the situation. They know what's happening, right? They know that, okay, I can do this or I can do this, but I'm not going to just take my, person who's going to put me under anesthesia or put me on this medication forever. I'm not just going to take their word for it. I'm going to do my research and, oh, wow, okay, this can't. Let me see what this is. So everyone's more educated. So there was definitely an uptick of people going, oh, I went to my other doctor and told me this is what I needed to do, but I wanted to find out about this first. There's more of that happening across the board.
Well, a decade ago, we used to see, or 15 years ago, we used to see people come through the doors of chiropractic clinics, WebMD educated. So they'd come in and they'd say, hey, this is my deal. This is what I'm dealing with. I've already done research. Check me for it. And really, that's what has hook, line, and sinkered people into modern commercials with the pharmaceutical situation. Is people watch the thing and they say, hey, I want this thing. This is what the TV tells me I should be doing. So what you're saying, Dr. Mike, is now we have this ChatGTP patient that is hyper influenced by the idea of doing research, and they've come in with a more scope of knowledge on saying, hey, this is my condition. I've already done my WebMD. I've already watched the pharmaceutical commercials, and I don't want the pharmaceutical stuff because I know that it makes me vomit and bleed and have diarrhea and suicidal ideation. I don't want that. And they know that they've already done their Google searches, which is old WebMD model. And now you're saying that we have this AI patient that's hyper aware and has had themselves negotiate through a robot.
Which is good and bad, because now they're trying to diagnose themselves too. So it's like, but it definitely helps with them finding less invasive and being more educated about their situation, which is very good.
Yeah, but what I'm saying is, like, we take this old model of 15 years ago to the TV model, which is still current, to this new model, which is what really my question earlier was, where do we see this profession going in the next 10 years? Is we see it wherever the necessity of information takes people, and wherever the truth and information takes people. Mm-hmm. And I think that that's really what Dr. Jason's last question was for you, is where do we see your guys' business go? Well, wherever we see people stop giving prescription pads to things that make people sick and turn them into addicts and make them homeless.
Well, based on what you're seeing though, right? You see the biohacking is getting huge. Even light therapy, like Retro Fitness has a light therapy pad. So people are starting to come aware of these various things. So a doctor that is offering that, or a laser center, for example, is going to be on the forefront of that. Like, I don't think that tide has turned yet. I think it's starting to. And if you need to get ahead of the game, and this is like getting the picks and the shovels for the gold rush. So,
Yeah.
and that's how I see it.
No, I appreciate that. And I just have a couple comments, and then James, I'm going to throw it right back over to you. And also, I just want to let everybody know we're running short on time, and we could probably talk for another 2 or 3 hours. You know, this is a fascinating subject, and everybody has pain. I mean, I think they say that 80% of adult Americans will experience back pain, significant back pain, at least once in their life. So this is not something that affects like a couple 100,000 people. I mean, this is millions and millions and 1000000s of people that we're talking about. So here's a couple of comments, and then James, right back to you. But I did want to say that there's some bipartisan, and usually I don't speak highly of politicians. I think that they're all crooks, and that's just me. Again, that's my personal opinion. But we have some bipartisan legislation that's come out. One of them is called In Prescription Drug Ads Now. The In Prescription Drug Ads Now Act. I know that we always are like RFK Jr. and HHS, and they're going to end commercials on TV and all this misleading stuff that we hear. That bill was actually introduced by Bernie Sanders. Bernie Sanders and Angus King. So, I mean, this is not, deep in the RFK Jr., MAGA, whatever you want to think about the current administration. This is bipartisan. Nobody wants these ads on TV yet. The reason that they're still there, everybody, is because of a special group of people called lobbyists that are actually controlling legislation. It's really not Congress. Congress takes their payouts and they vote the way the lobbyists tell them to vote. Anyway, hopefully we'll see that. Also, I just wanted to say, I'm deep in, and I know James is too, for different reasons. We're both deep in understanding AI. AI is an interesting tool, and I'm going to call it a tool. I think it can be good. It can be bad. I think that people rely on AI to give them credible information, need to be a little careful. And I'm not picking on any of them. My least favorite popular AI tool is ChatGPT. I think it fails.
Yes, man.
Yeah. I mean, yeah, exactly. I mean, it's going to be a mirror of you at best. And also it'll just mislead you. I mean, it's programmed by OpenAI, and OpenAI and the founders of OpenAI have contracts with massive pharmaceutical companies, and it's going to lead you. It's designed to lead you toward conventional care. And not even really thinking outside the box. Now, I think if you ask it something like, tell me about, laser therapy and this and that, it'll tell you some things, but it's going to tell you it's not well evidenced. It's going to give you all the stuff to and then here's what is evidence, and it's going to be drugs and procedures, right? And the reason I bring that up is because we mentioned AI. It is coming. I mean, it's here. It's never going away. James and I have had the pleasure of meeting Gary Vaynerchuk a couple of times now. And he, back to back in about a year apart. And, he's like, how many people are using the AI, like ChatGPT or something instead of Google? And, half the room, went up a year ago. This year, it was like everybody except for like 10% of the room. And I think we have to be careful about turning our knowledge base over to AI, because we have to remember it's not a perfect robot. It's not unbiased. The programmers have biased the LLMs. So just be careful. That's just my caveat to everybody. And that's me deep in trying to understand how to leverage that to help people. There's a lot of workarounds when you're trying to have the LLMs actually help people. There's a lot of barriers because they're designed to drive you toward conventional care and not toward alternative therapies like this. So just be careful. But James, right back to you. I know, actually, while I have it, Dr. Mike, I'm just going to say, because I know we're out of time, I want to say thank you. I learned so much on this call today. I didn't know what I was getting into.
Thank you for having me.
No, I mean, this was a very fascinating conversation, especially, for me, having worked with professional athletes and been in pain management for the first, 5 years of practice or so. And I think it's amazing. And I don't want to over encourage people, but if you're a doctor of chiropractic and you're out there and you're hearing this and you're like, I'm interested in that, just go to getbetterfasterpodcast.com. We'll connect you with Dr. Mike and his team, and you guys can explore what it looks like putting laser into your clinics to help people out. So, Dr. Mike, thank you so much. James, I'm going to pass it over to you for closing discussion.
Well, thank you, Dr. Jason. And thank you, Dr. Mike. I did want to make sure, Dr. Mike, that we gave you the last question. Is there anything that we didn't ask you today that you thought we should have touched a little bit more on?
No, we hit up so much stuff. I mean, we talked for an hour and 30 minutes. Not really. I mean, I think we hit everything. Is there something I can't think of anything off the top of my head?
I want to ask you a little bit more about the practice and the practice model, because I
Sure.
think that that's something we didn't anchor into, and that's what Dr. Jason was kind of sequestering to, is what does the practice and practice model look like for a practitioner, that if they're curious about this model, how does that work for them?
So you got to look at it as two practices, one roof, right? The Dunkin' Donuts Baskin Robbins situation, two entities under one roof. Now, you can either be a chiropractor with a laser, or you can be a laser pain center. And the reason why the perception matters, it matters from a client or a patient, prospective patient, whether they're going to come see you. Like we talked about, the 87% of people won't come see a chiropractor. This will open the doors for you to get them to come in. People will travel further distances to come see you due to this model. You also have people that actually will have other chiropractors that will come see you for your laser center, which is a crazy crossover that you see. So basically, you're implementing a turnkey, we call it our unfranchised model, bolt on into your practice, two entities under one roof. And the best way to describe it, and I have a great image for it, is basically two practices, one roof. Is really the best way to do it. And that will open the doors for you on getting patients in for those orthopedic conditions, shoulders, knees, elbows, feet. Because when you talk to patients during a consult and they label you as a chiropractor, the perception is all they hear is back and neck, back and neck. You can talk about knees and feet. They're not tuned in. They're thinking about other things. They're thinking about that, and they hear back and neck. So, but when you come into laser pain center, all those other conditions all of a sudden appear to them because you're not labeled as a chiropractor. So that's kind of how I would position that. So two practices, one roof, definitely would be the way to really view that.
Well, I just kind of wanted to give you that last question.
I appreciate that.
To explain to people what the model looks like for the practitioner and how it can really expand somebody's offerings. And really, the premise of the show is getting people better faster. And, if we can do that and we can get an attraction-based model of marketing from the 13% to the 100%, now we're moving the profession forward that I love and you love and Dr. Jason loves, is we're getting more access points to better quality of life for people, and
Yes.
it changes the conversation. So I think that was a big reason why I thought today's show would work so well, is because we're opening up the access points for marketing to people knowing what a laser can do, but also what the chiropractic profession has stood for 130 years. And if people do it the right way, we can help more people that wouldn't normally find their ways to chiropractic. So, Dr. Mike, the conversation today has been absolutely laser focused.
Thank you, guys.
Pun intended.
Thank you.
For our listeners who are out there and they're ready to stop masking their pain with the pills and stop letting an insurance company, like we talked about, decide what kind of care you deserve. Dr. Mike and his Relief Now Laser Centers and his team have built a roadmap out of that system. So you don't have to live in the same model that existed. There's a new model out there. And whether you're a patient looking for real solutions or a doctor who is done fighting with the insurance to get care that his patients actually need, head over to getbetterfasterpodcast.com and follow the links to get connected to Dr. Mike and his team. Dr. Rob and Dr. Mike, they do a fantastic job. They're helping doctors all across the nation. But for the people out there listening, remember this: nobody is coming to save you, but solutions like this can prove you can absolutely save yourself. Once again, Dr. Mike, thank you for being on here today. And to all of you, our incredible Get Better Faster Nation, thank you for tuning in and your continued support. Yeah, for sure. And out there, anybody that's still on with us, the best way to show your support for Dr. Jason and the Get Better Faster team is take your cell phone out right now and share this episode with somebody who needs to hear this, that's been suffering or searching for more answers or better answers. You could actually change your life today. I like the immediacy factor of what we do here is this show's live. You can share the show. I always tell people to take out their pen and paper and take notes throughout episodes. I didn't do that today, but if you're at this point in the game with us, take out your pen and paper and go back and watch the episode 2 or 3 times, maybe listen to it on 2x speed or 3x speed so you can get through a little bit faster. But
there's so much gold in this episode. I mean, it really is. And it's something that we really haven't discussed much with the pain. I mean, it's a big deal. Dr. Mike, thanks for being here.
Oh, my pleasure.
So last, don't forget to subscribe, guys, and never miss another episode with all of our incredible insights and interviews and the behind the scenes action we've got coming your way. We talked all the time about how to get help with Dr. J and his incredible functional medicine team at thyroidauthority.com. Click over to Get Better Faster podcast and we'll get you connected. We have more incredible guests that are lined up who are going to blow your mind with real solutions for reclaiming your health, your happiness, and your life. Until next time, keep questioning everything and keep getting better faster. Dr. Mike, Dr. Jason, thank you for being on today, and another amazing episode of the Get Better Faster podcast.
Yeah, thanks, James. Thanks, Dr.
Thanks,
Mike.
guys. Appreciate it.
Love you all. See y'all next time.
Bye for now.